The death of an elderly man whose daughter ignored doctors' advice has spurred a renewed call for senior citizens to protect themselves against COVID. The daily caseload, meanwhile, again exceeded 10,000. Isaac Lee reports.
Daily infections have once more entered five-digit territory. There were 10,426 cases today, more than 98% of which were locally acquired. Health authorities refused to predict when the latest wave will peak, saying the more contagious BA.5 subvariant has become the predominant strain. Another 7 people died after contracting the virus. They included a 77-year-old man who tested positive on August the 16th. When the hospital authority called him 2 days later, his daughter said he didn't need medication since he only had mild symptoms. But his situation worsened 1 week later, and he had difficulty walking and eating. He fell into a coma on Thursday and died the same day in hospital. The authorities stressed that it is important for patients, especially those aged 60 or above, to receive treatment as early as possible.
所有我哋已知嘅文獻咧，都顯示到咧。
For all the literature available, it shows that after people take the COVID medication, it will reduce the chance of hospitalization and, in particular, fatality. It's effective by as much as 80%. So if something could lower your risk by 80%, I'm sure you would go for it.
Lau also said 2 infants who were admitted to hospital earlier for COVID have improved, but are still in critical or serious condition. Isaac Lee, HKIBC.
Health expert David Hui says it will take at least 2 more months before Hong Kong can cancel hotel quarantine for arrivals.
Well, at the moment, we are actually having another wave. The number of cases is approaching 10,000. So hopefully when the BA.5 wave peak around September, then the case would come down. At the same time, if we can continue to lift the vaccination rates to generate better protection, then hopefully by November it will be in a much better situation.
Hospital Authority Chief Executive Tony Ko, meanwhile, said public hospitals are under tremendous pressure as they are treating around 2,700 COVID patients. He urged people to get vaccinated since nearly half of those admitted to hospital have not been triple jabbed. Ko said there are no plans currently to designate certain hospitals as treatment facilities for COVID, a strategy that was adopted during the 5th wave.